Hi everyone, my name is Nicole Fatka. I'm currently an athletic trainer working in the secondary school setting. My presentation today is about the evolution of guidelines regulating research in healthcare. I will also be discussing the Milgram obedience study. The Nuremberg Code is a set of research ethics principles for human experimentation created as a result of the Nuremberg trials at the end of the Second World War. The physicians and nurses and administration on trial had participated in killing mentally and physically impaired Germans, and they also performed medical experimentations on people that were in the concentration camps. The physicians, nurses, and administration tried to use the defense that these experiments were for the good of society. As a result of the trials, there are 10 basic principles that must be followed when using human subjects in experiments. So basically, the human subject needs to voluntarily give their consent and be at the capacity to be able to give consent legally. The human subject can also stop the experiment at any time if they have reached their mental or physical capacity. The results must be for the good of society, and the research must be designed around animal experiments or the knowledge of the problem or disease that is being experimented. Experiments must avoid death or disability, which includes preparations to the facilities being used. The experiment must be done by a scientifically qualified person, and that person must be prepared to stop the experiment if they feel the experiment may result in injury, disability, or death to the human subject. This declaration of ethical principles was first established because there was no guideline in using human participants in research. This was adapted from the Nuremberg Code. It is very similar, but it is specific to biomedical research. The first version of this declaration was in 1694, but the most recent version was adapted in 2013. The first version focused mainly on clinical trials. More revisions were done as research developed and the need to update terminology and clarifications. Just like the Nuremberg Code, the well-being of the subject should be top priority. Also, having the research protocol submitted to an ethics committee helps the research being done to stay legal and ethical. This declaration also suggests the consent from the human subject should be in writing. This is a great way to ensure the subject is actually giving consent and fully understands what the information is. This set of ethical principles should be continued to be revised due to the fact that healthcare is ever-changing and the standards need to be set for the current issues arising. On July 12, 1974, the National Research Act was signed into law, thereby creating the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research. There was attention drawn to the public when there was reports of abuse in human subjects in the Second World War and during the Tuskegee syphilis study. The participants in that study needed more protection than what was currently available. The main goal was to identify the basic ethical principles that should happen when conducting research involving human subjects. The guidelines were developed to assure research was following those ethical principles and to help assist in resolving ethical problems. The basic ethical principles mean people can decide for themselves whether they want to participate in a study or not, for the researchers to do no harm to their participants, and the researchers must share all aspects of their study, whether it be good, bad, or ugly. The critical case I will be discussing is the Milgram obedience study. The study was an interest to Milgram because of what was happening with the Nazis. He wanted to know how someone could be a respectable, upstanding person in regular life, but then commit these heinous acts. The goal of this experiment was to test the subject's willingness to obey orders from an authority figure. Milgram himself presented as the authority figure for this experiment. There was a teacher and a learner. The teacher was brought into a room where the machine was that would deliver the shock to the learner. He would say a word and the learner would have to respond with the right answer. If the learner did not, the teacher would be responsible for administering the shock. The learner was in on the experiment the entire time and was never actually shocked. The learner would make sounds and comments to make the teacher believe that he was being shocked and that he was in pain. The learner would even go as far as to say, "I want to stop, get me out." And Milgram would continue to push the teacher in order to see how far they would go. The study is extremely unethical. He put his participants in an extreme amount of stress. Milgram was very short in his answers to the participants' questions whenever they were asked, and he would just keep instructing them to deliver the shock to the learner. Nothing was ever taken into consideration on the participants' part. So from the study, the three main ethical issues I found were deception, protection of participants, and the right to withdraw. Milgram willingly tricked his participants to believe that they were delivering shocks and inflicting pain on the learner. He achieved this by having the learner in on their scheme and would have the learner remove the leads, and then they would just scream or make comments about how they were in pain or they wanted to stop. Milgram also did not protect his participants at all in this study. When the teacher would say he didn't want to hurt the learner, or when the volts were getting too high and the participant would say that I don't want to kill this person, Milgram would say whatever happens is my responsibility and to continue. This constant stress should have been recognized by Milgram, and the experiment should have been stopped immediately. This high-stress situation can lead to more psychological issues down the road for participants, which is why there are guidelines in place. Milgram's only concern throughout this entire study was finding the results that he wanted. He did not have any remorse for his participants. Milgram also did not give his participants the right to withdraw from the research at any point, even when it was clearly stated by the participants that they did not want to continue for whatever reason that they had gave. Milgram would pull a power move and insist that they have to continue. I understand that this was the entire purpose of his experiment, was a response to authority, but there was no remorse for the participants and there was no ethical regulation that was followed. Milgram just stuck to whatever he wanted, and the participants in this study unfortunately have to suffer the consequences.